So thank you attendees for joining us for the today's webinar. So let me introduce myself. So I'm Kalai Selvi. I'm the event coordinator at Texla American University. And today we are here to discuss about the topic, all you know about MRCS exam. I'm glad to introduce the speaker of the day, Dr. Tahura. Dr. Tahura is a medical professional who completed her MBBS degree from D.Y. Patel University in Pune, India. She is currently in the final week of completing her MS in general surgery at Fortis Hospital in Mulund, India. So today she is here to present on the topic, all you know about MRCS exam. So once again, we welcome you, Dr. Tahura. Over to you.
Hello, thank you.
Yeah, thank you.
Hi, good afternoon, everyone. I'm Dr. Tahura Swaguru. I'm here to tell you about everything about the MRCS. Let's start the session. So first, we'll start with what is MRCS. It is a membership of Royal College of the Surgeon, which if you clear this exam, you'll be able to practice in UK. So if you clear your MBBS, like if you clear your MBBS from India or from anywhere else, so you can appear for the MRCS after completing your internship. And also the postgraduate from the general surgery, ENT and orthopedics can attend the MRCS exam. And this MRCS exam can be given from the 4 college, which is England, Edinburgh, Glasgow, and Ireland. So MRCS exam is consistent of 2 parts, part A and part B. So part A consists of the multiple choice question, and it has 2 papers, paper 1 and paper 2. In total, it has 300 questions. Paper 1 will consist of the 180 questions and paper 2 will be consist of the 120 questions. And each question consists 1 marks. So you have to complete every question within 1 minute. And you get a 6 attempt to complete your first part of the MRCS. And that if you complete your MRCS part 1, it is valid for 7 years. Like till 7 years, you can give your part B of the MRCS. So when you can appear for the MRCS part A? So it happens 3 times a year all over the world. January, April or May. It is now not constant in April. This year it was in May. Last year also it was in May. And September. The things which you need to be prepared, like how do you prepare, from where can you prepare, that is what also I'm going to discuss. And how much duration do you need to prepare. So approximately you need 3 to 4 months to prepare for the part A. And the cutoff will be around 70%, which is approximately 70%, but it is not always fixed. Sometimes it can go 72, sometimes it can go 74, sometimes it can go 68. So it is not fixed. It is about the percentile. The fees is around 580 to 590 pounds. You can give 6 attempts that I already told you. And if you are giving for 3 to 4 months for the preparation, you can give like 3 to 4 hours a day. Some people prepare like they are already working and they are preparing for the exam. Some people are already completed with their post-graduation and they prepare for this exam. So it is different for the different people. What is your capacity? You can arrange according to that. So you start with the 2 to 3 hours a day and you progress to like a month prior to exam, you should at least give 7 to 8 hours a day. So, and then definitely you need a partner. While you are giving an exam, you should need a partner with whom you can study and you can do everything else. Like you can prepare, you can do the question answers, you can do the other topics, which are really important and which is not, if you're doing alone, you get confused. The first and the foremost, I mean, the important thing which you have to do and which is very important to do is EMRCS. EMRCS, its questions, it's a solution which is given below the exam, questions which are very important. You should always like read whenever you are doing a questions, you should always read the explanation given below. And also past test, which is like a reference purpose you should do if you have enough time, you're preparing for a very long time and you have already finished with the MRCS for the 3 to 4 times, then you can go for the past test. The next will be recalls and the FOSIA sheet. The FOSIA sheet is like very important. Every time you go for the exam or if you pick up any paper, last papers of the exam, almost 13 to 15 questions comes from the FOSIA sheet. The FOSIA sheet itself contains of the 300 to 350 questions, which are very important. And also recalls. Like if you're going for the exam, you should give you should do all the recalls of at least 5 years. Okay, 5 years is too much. Maybe 3 years, all papers you should do. And you should if you complete all recalls and the FOSIA sheet and EMRCS, definitely you're going to clear your exam. And you should keep an aim of at least 75. So you will achieve at least a 70%. So it is very important to do recalls, because most of the paper, whatever you're going to give the exams, or if you pick up any questions, you will see that 70 to 80% or 85% of the questions come from the previous papers. So it is very important to do recalls for their sheet and EMRCS. At least you should revise 3 to 4 times. Like all the EMRCS questions, you should do at least 3 to 4 times. Then only you should go. The anatomy, now I will tell how it is the division. So part A, our part A of the MRCS is 2, paper 1 and paper 2. The paper 1 will be basic anatomy, basics, which will be anatomy, pathology, physiology, and the maximum, if it's 180 marks of the total, the 75% comes from the anatomy. But it is not direct anatomy. They will not ask direct question. They will be like, there is person, surgeon performing, this is doing, but there, if we cut this missile, the below, now what is that? That type of questions will be there. It's not like a isca lymphatic, what is the lymphatic drainage of this? They are not asking the simple. Obviously, there will be a simple question also, but not all questions will be the straightforward questions. That's why you should know all, you should know the clinical knowledge also you should have, and you should also have the theory knowledge. That is the only time you'll be able to clear your MRCS exam. That is why you should do a EMRCS, because it is not very deep also, and they will give you the specific knowledge what is needed for the exam. There are other courses also which you can do, like there are online or offline courses which are there. There are online courses of Dr. Rida or Hashim. These are also good. If you want to attend, you have a time, you can go for that also. Then other than that, you're doing all these things. After that, you can, if you clear your MRCS part 1, you can go for the part B. So first we'll see what is about the part B. The part B will be the OSCE type. Like it will be a practical exam how it's there in the India. So it will have 18 stations. But then first we'll know about how is it. So it occurs every month. It is almost every month. It is there all over the world. But in India, it occurs 4 to 5 times a year. And the mainly centers are Delhi and Chennai. And you can appear for the any college. Like if you're given your part A from the England, you can go for the Glasgow for the part B. You can go for the Ireland. You can go for anything. But then in India, Ireland people doesn't have the, they don't provide in India. So you can go for the, if you're in India and you're planning to do your part B from the India, you can go for the England, Edinburgh or Glasgow. You cannot go for the Ireland. For Ireland, you have to go outside India. So then you can apply for the any college that I already told. And if you have given your part A from the England, but if you are giving your part B from the Edinburgh, so the final degree you will be getting, that will be Edinburgh. That won't be of England. And there is no difference between any degree. Like if you do it from England or if you do it from Edinburgh, you can do it from any college. It is just the same. Like if you do it from any college, it does not make any difference. The passing rate is also same. The question difficulties are also same, and it's all are same. So it's just a myth that you can give from this college or that college. It doesn't matter which college you give from. So now let's move on to part B. It consists of 18 stations. Like practically it has 18 stations, and which has 20 marks each. But then you have an extra 2 more stations, okay, which are for the rest stations because you're continuously on there. That's why. So 20 marks each station, 18 stations, and 10 minutes to one station. So which will be like your exam will be around 3.5 hours approximately. And also you can give your part B of exam after till the 7 years. And the part B fees is, I think, around 1,050 pounds. So the 18 stations are divided accordingly. 8 are applied knowledge, 10 are clinical skills. In applied knowledge, 3 will be anatomy, 2 will be pathology, and 3 will be critical care stations. For the total marks will be 160. And then approximately marks which is needed to pass is 107, 111. And for the clinical skills, there will be 10 stations. 4 will be clinical examination, 2 will be communication, 2 will be history taking, and 2 will be procedure stations. For each, there are 20 marks given and 10 minutes are given. So the passing marks is approximately 127 to 130, and the total marks is around 200. So first we go one by one. What is applied knowledge? In applied knowledge, it will be like mostly a revision of your part A. So you will be given 10 minutes. So how the 10 minutes are divided? The 1 minute, it will be given to read you a scenario, and 9 minutes will be for the Viva. In a Viva, there will be 10 to 15 questions each time. And one word answers will be there. And you can pass on to any questions. So because you don't want to waste the time, if you don't know the answer, you should not waste the time in thinking, what is the answer for that? If you waste the time and you lose the question and you're not able to answer all the questions which are there in the format, then you lose the marks. So that is why if you don't know the answer, you just pass the questions. So in applied knowledge, mainly it will be anatomy, pathology, and critical care. In anatomy, they'll be giving bones or atlas, netter pictures, which you have to go through. They will ask, what is this bone? What attachment will be there? Which bone, which muscle attachment will be there? What will be the action of this muscle? What happen if this muscle get damaged? What will be the nerve supply? That is all what they are gonna ask you. So in pathology, there might be pathology slides. In critical care, they might ask you a basic ECGs, chest x-rays, and abdominal x-rays. These are the basic things they will be asking in the applied knowledge in anatomy, pathology, and critical care. So what will be there in the examination? So for examination also, you get a 10 minutes. Every time, every station, you get 1 minute to read the scenario. But in examination, you get a 6 minute only to examine the patient. That is what you get the time to examine the patient. And you get 3 minutes for the viva. But make sure you're not taking any history of the patient in the examination part. Because it is not about the history taking. You have a different station. You don't have to ask a history in this. You have to give only examination part you have to do here. So in the 6 minute examination, when you are doing examination, the examiner will be just sitting there and will be observing you. He won't interrupt you. He'll just observe you. And after that, he will ask you a question. So there are some question will be given in his questionnaire. The same questions he will ask. And the same formula goes here. If you don't know the question answers, please pass on to the question so you don't waste your time. If you are not able to answer all the questions, he's going to cut your marks on the same. So there are two, then there will be a history station. There are 2 stations of the history. But in history station, what is different? In this, you'll have 2 examiners. One examiner will be a clinical, like a doctor, and the other will be a non-doctor. Now there is a non-doctor person sitting in the doctor's examination to check your communication skills, how you are speaking to a patient, how you are telling, how you are asking. That is what that person is for. And they together are going to give you a marks. So there will be a 6 minute given to take a history, 3 minute will be for the viva, and definitely 1 minute is for the scenario. So it goes for the every station. Then there's a procedure station. There are 2 procedure stations. They will be asking you a very basic procedures like suturing, catheterization, or IV cannulation. There are the procedure they are going to ask you. In this, there are no questions will be asked. 1 minute will be given for you to read, and 9 minutes will be given for you to perform the procedure. And in all the stations, there won't be any like patients. Mostly there are no patients, but there are actors who are like really act well and they have the all findings present, or there might be, if there is they might give a case of hernia or something like that. Okay, the last is the communication station, which is the most hard or difficult part. Okay, so in communication, you have 2 stations. First will be patient or a role-playing counseling. In role-playing counseling, or in what you will do, they will give you, in this also it's the same, 1 minute they will give to read the scenario. Then you have to go and speak to the patient or the patient relative. So in that, you might have to take the consent for some procedure, or you might have to break some bad news. And they will be sitting there and giving you the marks on the basis of the same. The second one will be a consultant's phone call. Yeah, you have to call the consultant and you have to ask him, you have to tell him about the summary on the SBAR format, which is, and then he will ask you a question on the basis of that. Okay, then how do you prepare for the part B? So you can go for the Turkey note or Sing notes, or these are the notes, and then you can go to Aklan videos, Meckman's Atlas or Netter Atlas. This can be used for the anatomy, which is applied anatomy part. Geeky Medics you can use for the examination, which is, they shows very nicely that how do you examine in a 6 minute. And which is very important for the part B is your partner. Study partner is very important. So you can discuss things and you don't get like, if you are wrong somewhere, so you can correct each other. And there are also offline courses like MRCS bootcamp courses. And there are also courses conducted by the RCS people, which is MRCS OSCE courses, which is by the Edinburgh and England. And one more thing is like, if you are appearing for this exam, you should be very like, you don't have to go through a books. If you go through MCQs, that is enough for the part A, I'm telling. If you want to refer to any book, definitely you can refer to your MBBS books, and there are many other notes. And you can also go through some Telegram group, which also gives a good knowledge. So there are people you can discuss questions. And also, if you are doing a recalls, so there are many recalls, you'll get it on the Telegram and other places also. But then if you're getting this is from anywhere, please check the answers are authorized or not, because sometimes the answers are wrong. Sometimes, most of the time, the answers are wrong. So you have to check it from the proper place. The answers are given right or not. Because most of the time, the same questions are given, different answers are different places. But most of the questions will be from the EMRCS. If you finish your EMRCS for the part A, I'm telling, if you finish your EMRCS at least 3 times or 4 times, you will be definitely able to clear your MRCS part A. And there should not be any problem for you to clearing your MRCS A. And like, you should give at least and few points, like when you're going for the exam, a day prior to exam, you should just finish everything. A morning, on the day of the exam, you should not read anything, because if you read anything, it keeps on going in your mind and you won't be able to come out of that, and you'll mark something wrong. And once you mark some answers, please don't change that answers, because once we change, we definitely tend to mark the wrong answers. So we should not change the answers what we have marked. We can also red flag the questions. Like, if you have any doubts on any questions, you can red flag those questions while you're marking it, and then you can repeat it. So, and you should do maximum MCQs as much as you can. So if you keep on doing the questions, so then your speed will increase, and you will have a maximum time to revise the whatever the red marks questions are there. And one more thing, there is no negative marking for the part A. You can mark all the question and you should attempt all the question. That's why you should have a maximum time so you can attend everything and you don't miss out on anything. Thank you. That is what I want to say. Any questions?
Yeah, thank you very much. Dr. Jafti from Rwanda. My question is coming to know that as you are here in Africa, need to know what is the requirement to apply for these MRCS. What is the requirement, and how this exam? I want to know if this exam is online, can be done online, or it is in person. Thank you.
So your question is basically who can appear for the exam? That's what you are trying to ask, right?
Yes, I want to apply for this exam, but currently I'm in Rwanda, and I want to know if it's possible to apply it online, and then I do it online. That's what I want to know.
Okay, so you can apply. Anybody who is post MBBS completed with his internship can apply for this exam. So this exam you can apply anywhere after your MBBS, after your completion of MBBS and an internship, and you can apply it online. And you can, I don't know about your area. You have to search for any centers are there or not there. Then you can apply the exams online. The exams are everywhere online, only part A. Are you able to answer your question?
Yeah, yes, I'm interested to do that, to apply it, and I was wondering if possible to start it on. I have seen how to start in September. For this intake of September to start it, and what I need to know is I have seen there's part 1 and part 2. Is only part 1 I can do online, and the second part is still required to go in face-to-face. That's what I want to know about that.
Part A, you can give it online, and you don't need any coaching also. If you can do it by yourself, that is also enough. So you can give the part A online. And for part B, you have to search for the centers. So there are centers in India. That is what I am aware of. There are centers in Cairo. There are centers in UK, obviously England. There are centers in all over the UK. So you can give all the centers. I'm not aware of your place. Is there any center or not?
I think the center which will be is for me. Can go in Cairo.
Okay. Yeah, you can go. If you have a center, definitely you can go, because all centers are same.
So any
Some
other
people
question?
have written the questions in the question answer session. So
Yes.
certificates are valid internationally. Yes, certificates are valid internationally. All this center deal with all the courses. I did not get your question. Which courses are you talking about? A part A and part B? Kiruba, can you please tell me your questions again? Yes, you can study from anywhere because it's just online. You don't have to go anywhere to study. You can just study by yourself. You don't need anyone. You can just, if one study partner also is enough, so you can do that also. Okay, one more question. How important is the practical experience? Yeah, obviously practical experience is important because as I said, that it is not only theory, because the questions are not only theoretical, like how in India, whatever the exams are there are all theoretical questions. But in MRCS, it's not like that. It contains the theory as well as the practical. As I said, that if you are if you go through a questions, they will ask, even in a simple anatomy question, they are not going to ask you a direct questions. They will ask you that how, if the surgeon is performing this procedure after cutting this muscle, what nerve will come, or if this nerve get cut, what will be the function will be lost, or that type of questions will be there. So definitely practical experience is important. That's why, like, if you want to appear for this exam and if you are a postgraduate in general surgery, orthopedic, or ENT, you should definitely appear at the end of your second year. So when till the time you have some knowledge of practical knowledge also. So if you appear in your first year or second year start, then you might lose on something because you don't know everything. Is there any common mistake you should be? Yeah, the common mistakes are like people, when there are questions asked, all are the part of this except, so we miss that except sometime. And I also said that some people are changing the answers, which I also did, and end up making the wrong answers choices. So once you mark the answer, definitely should not change the answer. And if you are stuck in some question, so please don't be waste your minute on that. And if you have already wasted a minute, please mark something and leave that question. If you don't mark that question, you waste a minute also. And if you put that question in the red and you don't mark, then you waste almost 1 minute of that question. And also you waste a minute after that when you're going to read that question. And whenever, if you don't know the question or you're stuck with the question, just leave that question. And when you move on to the next question, just think this is the new question. Don't think about the old question. If you don't know the continuously 5 question, don't get depressed, don't get panic, don't do all this thing. Just try to be cool that you know the things which are going to come further. You should know the simple ECG, simple X-rays, that also they are going to ask in MRCS Part A. What is the best way to handle the practical and clinical scenario part of the MRCS exam? The best way is to practice. Obviously, if you're working in the hospital, you should go to the hospital, examine your patient, put a 6-minute timer, try to examine your patient. That will be the best way to learn. How do you actively manage stress and anxiety? Stress and anxiety, for the stress and obviously whatever makes you like a day prior or the 2 days prior, week prior, you get a very much anxiety for that. But I feel, or what I did or everybody suggested, is that you have studied enough for last 2 months or 1.5 months, whatever you did. So last 10 days, you should rest. If you try to read till the last day, then definitely you're going to mess up when you go to your exam. So definitely try to avoid the stress by doing whatever you like. So you get a good sleep. Try to just revise whatever you have done. Whatever makes, like whatever subject you are good at, you just revise that for half an hour or so. So your confidence goes high. I think I've answered all questions. Any other questions?
Any other questions from the attendee side?
I think one more question is there, that is it yours is USA or UK? So the MRCS is for the UK, it's not for the US. And if you clear your MRCS, then you will be able to practice in UK. Or you can apply for any fellowship or everything. If you want to do, then obviously you have to complete your MRCS. It's like a license to practice in UK. Okay. Clinical rotations, no, it is not needed to do a clinical rotation. If you do only the theory, like if you are from general surgery, then you have some questions from the ENT, which is almost covered in the head and neck. And ortho questions are also there. Definitely, if you have read your ortho and your MBBS, so you don't have to go for the clinical rotation. If you have a chance, definitely you can go. But if you have not gone also, you can go for the exam, because I have not gone for any clinical rotation, ENT and ortho, and I completed in my first attempt. So I was able to do that. So I think you should be also able to do that without clinical rotation.
So I have a question. So after MRCS, can I practice in India as a surgeon?
Yes, you can practice as a surgeon in India. Definitely you can.
So
After completing your part A and part B, you can practice in India.
any other questions? So we have a question from one of the attendees. So after MRCS, can I practice in India as a surgeon? And even in government sector, can I practice or only in private concern?
You can practice in the private sectors.
So
Then
any
you can also do your private practice. That also you can do.
other questions from the attendee side? Part 2
Okay.
clinical training, how given in hospital?
So actually, I will suggest that if we want to go for the MRCS exam, part A or part B, it is not taught by anybody. You have to do it yourself. So if it's a part A or part B, all. So you obviously when you get stuck somewhere, you're gonna ask someone. But for part A also or part B also, it's totally depend on you. Like you have to put your 100% effect. Uh, and then you have to like part A, so definitely you're gonna study on yourself. But definitely when you're gonna work with somebody, when you go for the cases, you see, you operate, you assist, then definitely it is gonna help you. When you go see the patient, you see how the hernia patient come, what are the history, what is like if there are other cases are there, if the patient is having intestinal obstruction, what all we do, what if we do in the emergency basis, obviously that all is gonna help. And that is how they are gonna teach you. But nobody gonna teach you to come here, this is the one they are gonna ask you in part B. Nobody's gonna teach you like that. So you have to do it on yourself. And definitely when you are stuck somewhere, anybody, whoever is your consultant, are gonna help you in whatever situation you are. That is how I think it will help you in the part B and part A both, because part A also need a practical knowledge.
Yeah, so any other question from the attendee side? So I have a question. How was Texla provides training for part 2?
Actually, the Texila is posted us in the other hospitals. Like in Mumbai, they have Sefi and Fortis Hospital Mulund. So I am in the Fortis Hospital Mulund where my consultants are there, and they are gonna teach us. Like definitely we go with them for the cases and everything, and they teach us. So that is how. And also we have one teacher from the Texila who's like our mentor, Dr. Rafiq. He also teaches us, and he will tell us like about everything about like how you should do, what all stations are there, and more about this.
Thank you, Dr. Tahora. Thank you so
Thank you so
much.
much.